we'll go to the second series of case studies. We'll begin to look at to provide examples of how viral hepatitis elimination programs have did strengthen the a country's response to COVID-19. We'll first be hearing from Dr. Tamar Gabunia, who is a physician from Tbilisi State Medical University and holds an MPH from the University of Georgia here in the United States. She's currently the first Deputy Minister of Internally Displaced Persons from the Occupied Territories, Labor, Health, and Social Affairs Department of Georgia. She works as the first Deputy Minister, as I mentioned, in that regard. And I'll turn it over to Tamar. Welcome.
Thank you very much for your introduction. It's my privilege to share with you our experience of hepatitis C elimination, as well as describe how hepatitis C program helped us to be better prepared for the pandemic and overcome serious challenges we've experienced during, like many other countries experienced during COVID-19 pandemic. Georgia is a small country with 3.7 million population. Just to check, can you see my screen?
Yes.
Okay, thank you. Georgia is a small country with 3.7 million population. First ever hepatitis C seroprevalence survey in Georgia was conducted in 2015, and we found that approximately 7.7% of Georgian populations were anti-HCV positive, and 5.4% were HCV RNA positive, which indicated a quite substantial burden of hepatitis C in the country, and the decision was made to initiate hepatitis C elimination program, which was largely supported by the government and international partners, including Gilead Sciences, which provided access to life-saving drugs for free. And it's still like this. Georgia has very good support from Gilead, and drugs are readily available for all in need. So the first Georgian strategic plan for hepatitis elimination was developed in 2016, and it covered period 2016-2020. Key strategies were aimed at advocacy, awareness, education, partnership, and resource mobilization. We've implemented new programs for hepatitis C testing in healthcare setting and in general communities, which was very helpful to identify persons infected with viral hepatitis and offer them immediate treatment. In parallel with screening, we've developed laboratory capacity for confirmatory testing. Confirmatory tests were conducted initially in bigger central clinics. However, at this stage now you can get confirmation at many clinics at district level as well. And testing is readily available at primary care clinics as well as at Georgian Harm Reduction Network, which works with high-risk communities. It was very important to extend access to testing process, like screening possibilities to high-risk communities. These efforts resulted in a substantial decrease of hepatitis C prevalence by 2021. So repeated serosurvey showed that there was 67% decrease in seroprevalence, which was a great achievement. However, the program still continues its efforts to meet predefined targets. So these are key milestones. You can see that starting from 2015, a lot of efforts were made to improve testing capacity, make treatment available at more sites, to make sure that we achieve our targets by 2025. And our targets are as presented on this slide. We are getting closer, but we still observe substantial gaps in relation to certain indicators. This is mainly related to treatment enrollment. These days, we have around 14,000 individuals confirmed with hepatitis C. They know that they need treatment, but for some reason, they refuse to start on treatment. We've implemented targeted programs to tell them that they need specific treatment. However, it's not that easy to convince them to initiate on treatment. That's why these days we've been working on all directions of the care cascade. However, this is a key focus to make sure that we have all people confirmed with hepatitis C started on treatment. Georgia's success on hepatitis C elimination has been reported in various international journals and presented at various platforms. Key achievements which were very important, related not only to hepatitis C elimination specifically, but also to strengthening public health capacity for detecting and timely treating of various conditions. It helped to improve infection prevention and control in medical and non-medical facilities. It also helped to introduce external quality assessment system, as I mentioned, with decentralized testing and treatment by building capacity of peripheral clinics, with integrated hepatitis C, HIV, and tuberculosis screening programs at primary care level and harm reduction sites. We've also introduced point-of-care viremia testing and treatment initiation, and this is now free of charge and widely available. All of these achievements, as I mentioned, was recognized, and Georgia was nominated as one of the best sites for hepatitis C elimination by US CDC, as well as Georgia was recognized and designated as World Health Organization Collaborating Center for the Elimination of Viral Hepatitis in 2022, meaning that Georgia is now open for partnership, and it's a regional partnership. We have visitors from regional countries in the region which are interested in learning more about hepatitis C elimination, what worked, what didn't work so well, and then take this experience back to their settings. Of course, this is a huge experience, but we are very grateful for this designation and work hand in hand with World Health Organization and other partners to make the Georgian hepatitis C elimination model interesting and shareable to other countries as well. These days, as I mentioned, we are trying to continue our efforts to meet the program targets, as well as to expand the program to hepatitis B as well. So the new component was designed for the state program, which is aimed at hepatitis B elimination. This will include hepatitis B testing as well as treatment, and the drugs are not as expensive as it was for hepatitis C at the beginning. And we think that we can afford hepatitis B treatment drugs as well and provide a comprehensive coverage and to have hepatitis elimination program. So far, we were focused on hepatitis C, but now viral hepatitis would be our focus, including both hepatitis B and hepatitis C. Of course, having this experience helped a lot to address COVID-19 during a pandemic. Very important was having a well-established laboratory network, including PCR diagnostics. We had gene experts at district level clinics, and of course it helped us to quickly roll out COVID-19 PCR diagnostics and to have over 1 million Georgian citizens tested for COVID during the first year of pandemic. Of course, it was very important to have trained epidemiologists, which provided very good surveillance during COVID, contact tracing, and all that. Georgian National Center for Disease Control and Public Health acts as a reference laboratory, and this is very important to make sure that there is a good external quality assessment in the country, and this is how it works here in Georgia. And CDC acts as a referral laboratory for hepatitis testing, and it also did so for COVID-19, which helped a lot to make sure that we had a accurate testing system in place during pandemic. For treatment centers, of course, it was also helpful to have established treatment centers across the country. And those centers, they were actively involved in COVID-19 management as well. Primary healthcare doctors played a critical role, and of course, training provided during hepatitis elimination program helped them a lot to then quickly get familiar with COVID-19 testing techniques and how to use it in people with COVID symptoms. Strengthening infection control and prevention system actually was a crucial outcome of hepatitis elimination program, and like needless to explain how important it was for during COVID. In conclusion, I would like to say that allocating substantial resources to expand and strengthen healthcare system is very critical to be prepared for future pandemics. The process of building the hepatitis elimination program in Georgia has promoted the progress of healthcare system across various directions, including infection prevention control, diagnostics care, PCR, disease prevention, health promotions. That's why it's very important to have a well-established public health infrastructure and trained human resources to make sure that the country is ready for future emerging threats, to address future emerging threats. International partnership was really crucial, and international partnership established during hepatitis elimination program helped us a lot to access technical assistance very quickly in an efficient manner and have it implemented in the country for the sake of COVID control and COVID response. And I would like to take this opportunity and to express our sincere gratitude to all partners working with us during hepatitis C elimination program, as well as assisting us with COVID response and preparedness. We hope that this joint effort would enable us to achieve our targets by 2025, as well as to improve the system preparedness for future pandemic, and this contribute to strengthen the national health security agenda in the country and in the region. Thank you very much for this opportunity. Thanks.
Thank you very much, Tamar. Excellent overview. You gave us an update of the progress of the hepatitis C elimination program, which started before the COVID-19 pandemic, and then how it was applied to the COVID response in the country of Georgia. Thank you so much.